when it comes to you talked a little about patients accessing this tool if they have like a rare kind of mutation. Where are we at right now with patients being able to access some of these tools to advocate for themselves? Because I love this topic of passion and advocacy. If even if we're thinking about HER2 positive, HER2 negative breast cancer, I remember at the San Antonio Breast Cancer Conference last year, they talked about how African American patients often have a mutation that means that the standard treatment doesn't work and they're more likely to have it spread to the lymph nodes and things like that. And so in my mind, I'm thinking, okay, there are these new tools. If a patient has newly diagnosed with HER2 positive, HER2 negative breast cancer, what are some of the things that exist
Yeah,
already, if
so you
any?
are mentioning a very hot topic, which I discussed exactly in this session that I mentioned to you. Because one of the topics that it's very important now, especially when we are building tools, is the auditing of the fairness of the data. So what does it mean? The fairness of the data means that at least when we build these tools, we need to understand exactly which are the types of data that we use. If we, for example, we have built it in our lab, a tool that we presented to the WCLC meeting in the oral presentation and will be published very soon. It's a tool to clinical decision-making tool in the immunotherapy setting. Is a multimodal by using genomic data, real-world data, digital pathology, and radiomics. And it's a very nice tool because it includes also different ethnicities and different races also. And for example, University of Chicago, and exactly Chicago, since was the unique cohort that has half Black American and half, let's say, white American, we try to understand that honestly it was very nice to see how we auditing this fairness of this data. It was not very different in the overall survival. However, what we noticed, for example, the fairness was unfair. The data, how they were distributed among centers, because the other 4 centers was in Europe and others, for example, in Israel, which also they have no problems on genetics. Let's say exactly ethnicity or ancestry, etc. So the thing is that absolutely this is a very important thing, and AI what can do is 2 things. One, to audit them. Okay, so it means that to declare this bias and this fairness, because this is what AI Act, at least in Europe, have stated. And the other one is where they are, how we can recover. For example, and there are then many techniques which we called quantitative, not quantitative techniques to recover it. But for example, by try to harmonize the data in terms of images, harmonize the core to augment some cores that are not represented, try to, let's say, augment the external validation generalizability. Unfortunately, there are possibilities that this unfairness cannot be recovered every time, but at least they have to be declared in order to try to understand if this will work or no in medical desert, for example, states or populations.